We often think about hormones and digestion as two separate things, two separate processes going on. But what if I told you that your gut bacteria and digestion were secretly influencing your hormone level? And this isn't just an issue for women. Men, especially those on testosterone replacement therapy, may find themselves in this conundrum. Your gut microbiome plays a surprisingly large role in regulating estrogen levels. Certain bacteria in our digestive tract have an enzyme that allow it to reactivate that estrogen, allowing it to get back into our bodies, even though we're trying to eliminate it. And that can lead to all kinds of problems for men and women. Hello and welcome. My name is Dr. Taranella, and this channel is dedicated to helping you optimize and improve your health. Today, we're exploring the hidden gut hormone connection and estrogen imbalance for both men and women. If you're finding this information useful and valuable, hit that like and subscribe to continue getting videos like this one. Okay, so here's the problem. Estrogen, like many hormones, are processed through the liver through a conjugation process, and one of those is glucuronidation. Glucuronidation is the process by which you add a glucarate molecule to the estrogen or other toxins or things that are being processed so that they become more water soluble. In the process of making them more water soluble, they can then go out through the bile acid, through the digestive tract, and get excreted from the body. This is how your body naturally gets rid of estrogen and other compounds, toxins, etc., that our body utilizes and needs on a regular basis. However, in some situations, certain gut bacteria can produce something called beta-glucuronidase, and this enzyme basically cleaves the glucarate molecule from the estrogen, and it reverses the whole process. That allows the estrogen molecules that are in the digestive tract to get reabsorbed into the body, and then it's floating around in your body again. This then leads to higher estrogen levels in the body because you have both what you're producing and also what's being reabsorbed. And that happens even if your body is producing a normal amount of estrogen. It starts to build up in your system because it's always being reabsorbed. This isn't necessarily an important thing for everyone. It's important if you have this problem. And it's not just women that have this problem. Men can actually be affected by elevated estrogen levels too. And this is a process called estrogen dominance. And while it's usually associated with women, it can also happen in men. And so women that have this problem of estrogen dominance, because they don't have enough progesterone to support the estrogen, or they have just too much estrogen, which is what we're talking about here. And it can lead to things like heavier menstrual cycles, sometimes irregular menstrual cycles as well, PMS, fibroids, endometriosis, increased breast tenderness, headaches, mood swings, because estrogen can be stimulating. If you don't have enough progesterone to counterbalance that, it might lead to anxiety and restless sleep. And there's even an increased risk for certain kinds of cancers that are estrogen-driven, like breast and uterus. Men with high estrogen also can have problems. So estrogen increases the size of breast tissue, and for men that have ongoing high estrogen, it can lead to gynecomastia. It can also cause erectile dysfunction, low libido, and infertility, fatigue, muscle loss, increased body fat, mood changes like irritability, depression. Maybe you're more prone to crying, for instance, and even potentially increased risk for prostate problems, mainly being benign prostatic hyperplasia. I've definitely done other videos on high estrogen, so you can check those out when it comes specifically to men and women. Here we want to focus on the specifics of how your gut may be involved with this excess estrogen. Because whether you're a man or a woman, it can lead to increased fluid retention, fatigue and mood changes, sleep disturbance, headaches, and even increase your risk for blood clots because estrogen is a prothrombotic agent. And so you can think of the problem kind of like this. You're basically packaging up all the estrogen for disposal, like putting it into the recycling bin or the trash can. And then the bacteria come along with their beta-glucuronidase, and it's basically like a neighbor going into your recycling trash bin and piling it up back in your refrigerator or putting it somewhere in your house. This is going to lead to a buildup of that garbage, those recycled items in your house somewhere, wherever they're putting it. A lot of times when you have this problem, when it's showing up on your blood test that you have high estrogen, we're going to focus on therapies, maybe medications, maybe supplements that are going to help your body get rid of the estrogen, but you're overlooking the neighbor that keeps putting it back in the house. And so you might try supplements that can help increase the excretion of estrogen and detoxification of estrogen, or even medications. But if you have this problem, it's really not going to help a whole lot, and it's going to lead to more frustration and possibly ongoing health complications. And for men, often the problem is completely overlooked, and the solution is, well, just go on the estrogen blocker, anastrozole, and move on. And a lot of times this works, but a lot of men don't necessarily want to take this medication. So we're going to get into what you can do and what you can look at if you're having this problem. So really the issue is the lack of awareness of the connection between you're having high estrogen and you also have gut issues. Sometimes people don't have symptoms of this, but they do have symptoms of this. And just because you have this doesn't necessarily mean you have this, but if it hasn't been looked at and you do have symptoms, it makes a lot of sense to take a look. And a lot of times for men, this is going to come on suddenly because you're taking the testosterone and gradually your estrogen levels are going up. Because you're not getting rid of it, it keeps being recycled. You're not able to stay ahead of it. In the case of women, it usually goes up slowly over time because as this problem in the gut gets worse and worse, the estrogen levels climb gradually. So that's a problem. If you made it this far in the video, you're probably asking yourself, okay, how does this bacterial enzyme or this bacterial problem actually affect my estrogen? And why is it affecting me versus someone else? Why isn't this a problem with everyone? So let's break that down for you. So your liver is basically processing a lot of different hormones and toxins, including different kinds of estrogen, but specifically to this, it's the estradiol or E2. And it uses many different processes or what's called phase 2 deconjugation enzymes to do this, and one of them is called glucuronidation. The glucuronidation enzyme is called UDP glucuronyl sulfur transferase, or UGT for short, and it attaches a glucuronic acid to the estrogen molecule to make it more water soluble. This enzyme, like all enzymes, are under genetic control, and so some people may be hindered naturally by their genetics of this as well, and that can lead to an even more big problem. Once the glucuronidation process has occurred, it makes estrogen and other molecules more water soluble. It can go out through the bile, and then it's going to be excreted into your digestive tract and out through your stool. When it's curbing through the digestive tract, it also interacts with a lot of microbes. There's trillions of different microbes in our gut. We have more microbes than we have cells in our body. And those microbes play a critical role in our digestion, immune function, and in this case, hormone regulation. Certain kinds of bacteria have more of this beta-glucuronidase enzyme activity. And this isn't necessarily a bad thing, but it's really when you have an abundance of the microbes that have this activity that can lead to problems. So there's certain types of E. coli and Clostridial species that are going to have this issue. And basically what it does is it cleaves off that glucarate molecule or glucuronic acid, allowing that estrogen to become reactivated and recycled back into your bloodstream. And so you might be asking, why is this happening to me now? Why didn't I have this before? And there's a lot of different factors that can play into that, but a lot of times it does come down to dysbiosis or imbalances of those microbes in your digestive tract. And so there's two main reasons here to think about. You can have an overgrowth of the bacteria that produces this beta-glucuronidase enzyme, and we see this commonly with SIBO, or sometimes you just have a relative imbalance of the bacteria that produce the beta-glucuronidase enzyme. And so you don't actually have SIBO, you just have a relative shift in that, and that can sometimes be accompanied with genetic problems as well, amplifying the issue. So what causes these bacterial overgrowth or SIBO issues? Well, you can definitely check out some of my other videos on this topic, and I'll definitely link to some things here as well. And sometimes you can just have more mild issues, and the dietary changes can make a big impact. And the foods that are generally going to promote this are going to be really highly processed foods. Foods that have higher sugar, higher fat are going to promote certain types of bacteria that have this enzyme activity. And some of the details of this are not exactly clear, but the microbes that tend to have more of this beta-glucuronidase activity, especially when it's showing that it's in excess, is highly suggestive of a bacterial overgrowth scenario. And the food that you're eating definitely can impact that or make that worse and amplify that problem. Sometimes we've just had too much antibiotics and it's wiped out the microbes that were more susceptible to it, maybe the ones that didn't necessarily have the beta-glucuronidase activity. Now the ones with beta-glucuronidase activity are higher, allowing for more of that reabsorption of estrogen. Constipation and slow transit time can also give those microbes a little more time to do this deconjugation activity. And sometimes too, with constipation or decreased downward movement in your intestines due to various reasons, can allow microbes to migrate up into the small intestine, giving them, again, more opportunity to cleave that glucarate molecule. In a similar vein, low stomach acid often leads to more bacterial overgrowth or more bacteria in the small intestine and may lead to this issue as well. There's also SIBO and post-infectious IBS, which are oftentimes have a lot of overlap in terms of what causes them and the symptoms that are presenting. For those taking testosterone replacement therapy or males with just high estrogen, the same issues can actually be present. The difference here is that your testosterone gets converted via aromatase activity into estrogen, and the same process is happening in females as well. It's just that males don't have as much of that aromatase activity. And so in cases when you introduce exogenous testosterone, you're going to have a little bit more of the aromatase activity naturally. But sometimes if your bacteria are basically putting the estrogen back into your system, those levels are going to continue to climb, not to infinity, not forever, but you're going to have much more trouble keeping those estrogen levels in check. If you're introducing testosterone into your system and you also have these gut issues or more bacteria that have this beta-glucuronidase activity, you're going to have double the amount of estrogen instead of just the amount from introducing the testosterone. And I think while we're on this topic with men and estrogen, it's good to point out that estrogen does have good properties. Same way it helps women, it can also help with men, allowing for arteries to dilate, which having a connection to erectile issues, and also helps to have a more balanced mood. But it's really when it's in excess above a certain level, say about 40, and some men may tolerate even a little bit higher levels. So it's important to keep that in mind. But let's take a look at what the research says about this. Is there anything to document that the gut microbiota or the digestive tract has anything to do with hormones? And the answer is yes, definitely there is. The scientific literature is increasingly recognizing the relationship of the gut microbiota and beta-glucuronidase with estrogen levels. And I'm just going to highlight two studies. One in the Journal of Translational Medicine, they found that specific gut bacteria are associated with both increased levels of fecal and systemic estrogen levels. And in this study, they were looking specifically at postmenopausal women. Another study in 2016 looked at the role of the gut bacteria metabolizing estrogen and highlighted the effect of the beta-glucuronidase in certain estrogen-related diseases or health issues. So research definitely has confirmed the role of the gut microbes in regulating hormone levels or actually causing levels to be elevated or sometimes suppressed, depending on which angle you're looking at. And it's thought to be directly related to the bacterial beta-glucuronidase activity and the abundance of those microbes in each individual that's contributing to high, low, or normal estrogen levels. And so now let's say you checked your levels and indeed they are actually high. What can you actually do about it? Well, first I would just say, estrogen levels are going to vary a lot in women that are menstruating. And in men, it's going to vary a lot based on where you're at after your testosterone injection. If you're not injecting testosterone, doesn't matter. And if you're postmenopausal, doesn't matter either. But for women, you want to capture and remember that estrogen is going to be highest right after ovulation, and then it's going to start coming down. So there's actually different reference ranges for different parts of your cycle. And for men, estrogen levels are going to be highest shortly after the injection, maybe 2 days or so after your injection, maybe 3 days. So here's what we can actually do if you're finding and thinking that this could be a problem for you. In terms of diet, it's really about eating to support the bacteria that don't actually produce this beta-glucuronidase activity. And in doing that, you're going to crowd out the ones that do produce it. So that means we want to aim for more fiber-rich foods, more things with dark colors, fruits, vegetables, and sometimes whole grains, but not in too much abundance. This is going to promote regular movement of the bowels, so things aren't slowing down too much, giving them too much opportunity to cleave the glucarate off those estrogens. We also want to limit the processed foods, the high sugar intake, the high fat intake foods that are going to promote the bacteria that produce more of this beta-glucuronidase. In some cases, if we think you might have SIBO, or you may even want to consider this, trying a low FODMAP diet. Low FODMAP limits the amount of fermentable foods in your diet, which is going to reduce any overgrowth of bacteria. Now, it's not going to get rid of the overgrowth. It's just going to reduce a little bit the activity of those microbes, which on the margin could be helpful. Probiotic supplementation could be useful, but we also want to be careful that if you do have bacterial overgrowth, this could potentially make things worse, especially if it does have a prebiotic in it. If you do have kind of a more subtle case of dysbiosis or imbalance, then adding in a probiotic can really be helpful to help shift the balance of microbes that are in your intestines. Outside of gut support stuff, you can actually take calcium D-glucarate. And some people just have lower glucuronidation activity because of their genetics. And so adding more of the glucarate into your body, called calcium D-glucarate, can really be helpful in the case that you have excess estrogen. Of course, you always want to discuss things like that with your doctor before introducing things like that, just to make sure you're not causing more problems. Another thing is just supporting your overall liver health and estrogen metabolism. That could be things like reducing alcohol intake, maybe taking things like milk thistle, which is just going to help your liver work better overall. And then lastly, addressing constipation. The regular movement of your food through your digestive tract and having regular bowel movements is going to keep the estrogen away from the microbes that are going to cleave it. And so there's just less opportunity there for those microbes to do that. Sometimes fiber and dietary changes aren't enough to keep that movement going. And it's not just whether or not you're having a bowel movement, but how long the food is sitting in the intestines, allowing for those microbes to have that interaction. And that can happen from not enough bile flow or SIBO and various other digestive issues. This is where testing comes in, and using things like the GI map test can be really helpful to pinpoint whether or not this problem is occurring. So I just wanted to take a moment to say, if you're struggling with estrogen dominant symptoms, whether you're male or female, and you want to optimize your gut health and understand that connection, I have 2 different courses on this topic, one on optimizing digestion and one on post-infectious IBS, where that goes into details on SIBO as well. So here's the key takeaways on this topic. Your gut microbiome significantly regulates and can lead to much higher estrogen levels. Certain bacteria do produce an enzyme called beta-glucuronidase that allows the estrogen to get reactivated. And this can and does contribute to higher estrogen levels in men and women. What you can do is address your dysbiosis or SIBO or bacterial overgrowth through diet, sometimes probiotics, and then testing to take a careful look at whether or not you do have bacterial overgrowth can also be useful. It's also important to remember genetics, because some people have lack of glucuronidation activity in their liver and throughout their body. That's where calcium D-glucarate can come in and help lower those estrogen levels. Hopefully this video helps you better understand how digestion is affecting your hormones. If you have questions, definitely drop them in the comment section. If you're looking for a more personalized, direct access to help you along your health journey, click on the button below, the join button, and as a member, you'll have access to more detailed answers to your questions, and you'll also be supporting the channel. Now, one question you might have after looking at this video is, what exactly is post-infectious IBS? And you can find that video right here. Thanks again for watching.